Okay, so once again, good evening everyone. So today myself, Dr. Rachel Agarwal, I am the orthodontic faculty at DAMS. So we are back with the evenings session at 8, the MDS 360 degree, the 1 hour power pack sessions which are going on every week, day of the week with different subjects every day. So today being Thursday is a orthodontic class day. So in this 1 hour, I'll try to cover in brief the topic. Okay, last time a student asked me to take up cephalometrics. So in the next session or the next week, I'll take up that topic. So today we are going to discuss the evolution and components of fixed appliances. A lot of image-based questions comes in your NEET NDS exams as well as INI CET exam as well. How the appliance evolved and the fixed appliance evolved and developed, and what are the various components of these appliances. Okay, so once again, good evening everyone, those who have joined. Okay, I think we fine. Face is not coming in the camera. Just a minute. Okay, so there was small technical glitch that's been rectified. Now we'll start. Okay, so once again, good evening everyone. Today's topic is evolution and components of fixed appliances. So as I was telling, a lot of image based questions comes from this topic, and certain theoretical questions, name based, how, when, who gave that appliance and all, and what is its use. So primarily image based questions comes from this topic. So beginning with the first fixed appliance which was developed, it was developed by Dr. Edward Hartley Angle. So we are going to first discuss his contributions to the development of orthodontics. So in that top of that, he is considered as father of modern orthodontics. The first appliance which was E-arch, or E stands for expansion arch. Okay, so first important thing is this E-arch appliance was not given by Angle. It was given by Pierre Fauchard, and this name will be familiar to you because he is considered as the father of modern dentistry and orthodontics. So he is the father of modern dentistry and orthodontics. Okay, whereas Angle is considered as the father of modern orthodontics. Okay, so first question, another question, that E-arch was not given by Angle. If the question comes in MCQ, who gave E-arch? So E-arch or expansion arch was given by Pierre Fauchard. Angle later on developed and modified this appliance. So there is a tendency of confusion between students. Angle never gave this appliance. He developed and modified this appliances. So it was given in the year early 1887, or you can say late 1800s. Okay, so what does it consisted of? It consisted of this rigid framework, okay, to which the teeth were tied. So all the teeth like this were tied to this rigid framework like this. If you can see in this image, this premolar is tied, this lateral incisor is tied to this rigid framework. Okay, and all the teeth, well, what happened was, when they were tied, they tend to expand with the help of this appliance. What happened was, when the teeth were tied, they tend to move according to this arch form dictated by this rigid framework. Okay, so this was the appliance, that E arch, which was given by Pierre Fauchard. So what modification did Angle did to it? What he did was, he placed angle modification. He placed, first of all, he placed bands on the first molar. Okay, second was, there was introduction of heavy labial arch wire around the teeth. Okay, now this heavy labial arch wire, what he did was, what modification he did was, because it was placed by Pierre Fauchard himself, the modification he did was, he placed small nuts to this arch wire. Okay, so what happened, like this, you can see. Okay, sorry for the interruption. There was some technical glitch. Now we are back online. Sorry once again for that interruption. Okay, so as I was telling, when this interruption occurred, that angle modification of this expansion arch, for first modification was placement of bands and nuts. So as I was telling, what was the advantage of these nuts? These nuts, they were simultaneously, or you can turn them around, so that this arch perimeter was expanded. This arch perimeter can be expanded so that it can be increased. Okay, so the arch perimeter can be increased. So this was the second modification which was done by Angle, by placing of small nuts. Okay, so what was the disadvantage or drawback of this appliance? So that there was a need to develop the second appliance, that is the pin and tube appliance. So the drawback or disadvantage was, which is clearly understood, was that these teeth, the individual teeth, were just tied to this arches. So there was poor, only heavy interrupted forces were given. Only heavy interrupted forces were delivered. And next, there was poor rotation control. We were not able to derotate the teeth with the help of this E arch. So next came the pin and tube appliance. Okay, so now from now on, the other appliances or the subsequent appliances which will come, they were all given by Angle. Okay, so as I was telling, the previous E arch was only able to tip the teeth. They were just tied and the teeth tipped into the expanded arch. So they were only able to tip the teeth. Okay, they were not able to provide any kind of precise positioning to the individual teeth. So what he did was, so to overcome this problem of tipping of these teeth, that means the crown portion only tipped and the root remained at that position. To overcome this problem, what Angle did was he placed bands on every teeth. So all the teeth were first of all banded. Okay, so what advantages did banding serve was it provided more rigid control over the movement of the teeth. Still the rigid control mil gaya, but we were not able to prevent the tipping of these teeth. So what next modification was he did what he used a vertical tube on each tooth, into which soldered pins from a smaller arch wire was placed. Soldered pins were placed. Okay, so vertical tubes with soldered pins were placed to prevent this tipping and provide a bodily movement of this. Okay, so how this tipping was prevented, or how does this tipping of the teeth was corrected by the, so on each appointment these vertical tubes were repositioned. So imagine that once we solder or weld a band, then we weld the tube, and on each subsequent appointment you have to reposition this vertical tubes. Okay, so imagine how much time on each appointment it used to take place in the year of 1910 when this appliance originally came into being. Okay, so this was the pin and tube appliance. Okay, so next came the ribbon arch appliance. Okay, so the disadvantage I have already mentioned, the amount of time it took per appointment to correct the position of the teeth. Okay, so to prevent or reduce the chair side time, what Angle did was he developed a ribbon arch appliance. So what modification he did was he modified the tube on each tooth. So as to provide vertical position, rectangular slot behind the tube. Okay, so this was the bracket, or this was the modification. Okay, so the part of the tube was sliced to receive the ribbon arch. So this was the ribbon arch, and this was the cross section of the ribbon arch. Imagine a rectangle, bit more of thickness, lying like this. So the how did it help? There was reduction in the time, because now we don't have to reposition the vertical planes at each appointment. Okay, next important MCQ point of view was that the ribbon arch wire, what was the diameter? It was made up of 10 cross 20 gold wire. Okay, 10 cross 20 gold wire was placed into the slot and held with pins. So gold, as you all know, have good malleability. Okay, so it was small enough and had a good spring back qualities, which was efficient in aligning malpositioned teeth. So at that time gold was much cheaper than stainless steel. Okay, still the disadvantage was there, that there was poor root control position. Roots were not adequately positioned or correctly positioned. Okay, so it was not able to provide the required torque or necessary movement to position the roots to the new position. So next came the edgewise appliance. So this modification, this edgewise appliance is the last series of modification before angle's death, and this appliance is still date used today. Now we are in 2025. The further modification or further whatever you study, MBT, Roth, Damon prescription, all came from this appliance. Till date, none other modification has happened. Only there was tip and torque. The basic modification or basic premise of the appliance was this edgewise appliance, which was given by Edward H. Hankel. So till now, what we used to have was this vertically oriented slot like this. What Angle did was he rotated this vertically oriented slot from vertical position to horizontal. So from vertical, the slot became like this, which is the current bracket, if anyone has seen, like this. Okay. Now, since the bracket rotated by 90 degree from vertical to horizontal, the arch wire also rotated. Earlier it was inserted breadthwise, now it was rotated 90 degrees. So that's why this name edgewise came. So the arch wire rotated 90 degree, which was called edgewise. Along the edge it was rotated. Okay, so the slot dimension now is 22 cross 28 mil, or in inches it is 0.022 into 0.028 inches. Advantage: now it provided excellent control in all three planes of space, that is excellent control over crown and root position. Okay, so this is the latest series or the latest edgewise appliance. So what Angle gave was single edge. Now later on it was modified and two slots were added to make it a standard edgewise or a non-programmed edgewise bracket. This is like this. What do you mean by non-programmed and programmed? I'll tell you. So this twin slot or twin bracket appliance, it provided excellent rotation control. The wire is rigidly gripped at 2 points, so rotation control was very good in this appliance. And slot dimension I've already mentioned. Okay, so there are two slots dimension which are available, or two types of brackets which are available in the market: 0.022 or 28 into 28. We just call it O22 slot, and next is the O18 slot. Okay, next the rectangular wire contacts at 2 points, so 2-point contact provides much better control over the crown and root position. Okay, next MCQ question: what will be the maximum dimension wire which can be inserted in the O22 slot? It is O21 cross O25, providing 2-point contact, achieving proper torque control of the crown and root position. Okay, so maximum dimension in O22 is 21 cross 25 and O18 is 17 cross 25 wire. Okay, some necessary points to be noted: that the wire should be able to freely move within the brackets. There should be at least 2 mil of clearance. Mil is a British standard measuring unit. If you want to convert it into inches, divided it by 1000. And 4 mil clearance is desirable. Please clearly note these words: desirable and needed. Okay, so for 18 slot it can be 16 mil and 14 mil would be satisfactory. For a 22 slot, 16 or 18 mil would be satisfactory to deliver the correct force. And what should be the ideal width of the bracket? The width of the bracket, it should be half of the width of the tooth. You cannot increase the width of the bracket so as to provide more and more rotation control. It should be practically should be half of the width of the control, but this is not in our hands. This is in the hands of the companies or the engineers who design these brackets. Okay, what we get is a ready-made milled bracket based on the average mesodistal dimension of the tooth available in the human population. Okay, so this was the edgewise appliance. Next comes the archwire bends required in the conventional appliance, edgewise appliance. So as I've already told you, these are non-programmed edgewise wires. So what do you mean by non-programmed? So as we all know, there are certain root and crown angulation or inclination should be present. Okay, if anyone had seen a CBCT of a maxilla and mandible, you could have seen that tooth, be it incisor, premolar, are oriented three-dimensionally at certain angulation and inclination inside the bone. They are not like parallel like this when you see on OPG. So on a three-dimensional image, they have certain inclination and angulation. Okay, but when this non-programmed or edgewise appliance came, this angulation or inclination was not present in the bracket. So we had to give these angulation and inclination by placing bends inside the arch wire. So what are these bends? So for these are the three orders or the three types of bend: the first, second and third order bend. These are very important for your both AIIMS and NEET exam. Hardly a exam passes where this question is not asked based on an image form or an MCQ form. Okay, so these bends required for the compensation of the inclination and angulation of the teeth are known as the first, second and third or the order bends. So they were needed to be placed inside the edgewise brackets because they did not have an inherent bends on inherent prescriptions prescribed in them. Okay, how they are prescribed inside the bracket, I'll just tell you after a few slides. First, understand these bends. So first is the first order bend or the in-out bend. So these are placed to compensate for the difference in the buccolingual thickness of the teeth by varying the bracket base thickness. Okay, so this is the first order bend. So imagine looking at the upper and lower arches from occlusal point of view. Okay, so the centrals are thicker as compared to the lateral, the canine is thicker as compared to the lateral. Okay, so these first order bends are given to compensate for these varying thickness of the inside of the teeth. Okay, so these are the first and first order bend. How are they prescribed inside the bracket? Is by varying the bracket base thickness. So if we come to this diagram, if I increase this thickness, this part, the wire, so what will happen? This part gets thick, so the wire when inserted will get certain, imagine this slot. Now this heads placed on the teeth, this part gets thickened as compared to the adjacent bracket which is thin. So what will happen? Now the wire is coming like this. Now there will be a certain kind of deflection here. So what will happen? It will exert pressure on this tooth to go inside like this. So this is how a non-programmed bracket becomes programmed. So we have programmed it to incorporate this first order bend. So if a non-programmed bracket is there, we need to place these bends like this inside the wire so as to compensate for this buccolingual prominence of the teeth. Okay, so from non-programmed, by varying the, so you don't have to do this varying the thickness, this is all done by the manufacturers. Next are the second order bends or the artistic positioning bend. So this is very important because a confusion occurred in the previous NEET 2024 exam about the types of second order bends. So first of all, what is second order bend? These are artistic positioning bend used to achieve the correct mesodistal inclination of the teeth by cutting the slot at an angle. So again, coming back to this diagram. So as I've told you, the teeth are inclined at certain mesiodistal inclination. Okay, so if they are not, so need to place the bends like this inside the wire so that they correctly get inclined. Or otherwise, if we just cut the slot like this from here and there and get it at, so when a straight wire is played, the teeth automatically gets inclined. So these are the tip back bends placed in the posterior. So there are certain types of second order bends. There are long second order bends, short second order, long placed in extraction cases. Okay, supposedly you extract 4, that is first premolar, then the second order becomes long. Short second order bend. They can be step up and step down bends, which are known as V bends. Okay, they are placed between the anterior and posterior teeth. Okay, that is between the canine and a lateral incisor to differentiate between anterior and posterior torque. Fourth is the tip bends, and lastly these are the artistic positioning bends for anterior teeth and tip bends for anchorage preparation. So for anterior teeth, these are known as artistic positioning bends, so as to place the teeth artistically or at the desired inclination. And lastly are the tip bends for anchorage preparation. If you remember from the last session on anchorage, I told you that posterior teeth are tipped back so as to provide good cortical anchorage. Someone asked me also about the tent peg phenomenon. And lastly are the third order bends or the torquing bends used to give correct buccolingual root positioning by angulation of the base or face. Okay, so torquing bends to correct the root positioning. So this is the second order bend and this is the torquing bend to correct the root angulation. So instead of placing bend in the wire, if we just angulate the slot like this, so the wire automatically goes like this and corrects the root torque. So this is the another image of first, second and third order bend. So from non-programmed we evolved to the pre-programmed bracket. How? By weighing the thickness, by cutting at the angulation, cutting the slots at the certain inclination, or by torquing the face. Okay, so if it's clear the first, second order, third bend, if anyone has any doubt, just write in the comment section, otherwise I'll move ahead. Okay, so what were the major steps in the evolution of this edgewise appliance? Now, due to the presence of twin brackets, which I just showed you, there was automatic rotation control. Okay, second advancement, there was alteration in bracket slot dimension. So using a smaller slot like 18 slot, okay, provided prior or early root control, torque control. Next, the evolution which I just showed you, evolution of pre-adjusted edgewise appliance. So it eliminated the need for placing bends in the arch wire. So by varying the design of the bracket, the need for placing bends in the arch wire was finished or eliminated. So this became the first generation pre-adjusted edgewise appliance, which was given by Lawrence F. Andrews. So there are typically 3 generations. So first was the one given by Andrews, second is the Roth's prescription, and the third is the MBT prescription. So there are many more prescriptions based on the desired tip and torque values as thought by the respective scientists. Till date, there are more than thousands of prescriptions which are available in the market. Each orthodontist or each engineer or each dentist think of about their own desired positioning of the teeth inside the bone so as to prevent relapse of those teeth, and have given their own prescription. Okay, so primarily these are the three generations which you should know. So next came the Begg appliance. Okay, so the Angle had two students. One was, there were many students, but the two who became popular were Begg and Tweed. Tweed stayed with Angle, okay, and may gave his Tweed appliance and his theory, which we're going to study in the upcoming slide. And Begg, or Raymond Begg, okay, he studied with from Angle in the United States, and then he moved away to his hometown in Australia, and there he gave his own philosophy, modified the appliance, edgewise appliance, and gave his own appliance, that is the Begg's appliance. Okay, so what modification was there was, first of all, he again inverted the ribbon arch bracket. Okay, so from edgewise, as I have told you, horizontal vertical से horizontal बना edgewise में, Begg appliance में all again he oriented it vertically. Okay, and he gave his light wire differential force technique. Okay, so the basic main philosophy behind his thinking was that in edgewise appliance, what he found that using heavy rectangular arch wire led to increase. If you are using light heavy forces or heavy rectangular wires, so heavy forces will be delivered on the teeth. So if you are delivering heavy forces, there became a need for having more anchorage preparation. So more time was wasted on preparing first anchorage and then moving the teeth. So what Begg did, what he modified was that he eliminated the need for using heavy rectangular wire. He said use of light small forces, less need for anchorage preparation, less time taken for the treatment to get finished. And the slot dimension of the Begg bracket was 020 into 04, 0.045. Okay, I hope I am clear. Okay, so as I was telling, he used high strength 16 mil circular SS wire. So from rectangular he again jumped back to circular wire. Okay, so in the previous pin and tube and ribbon arch appliance, as I told you, the slots were vertically directed. So here in Begg's appliance, it was also vertically directed, but the orientation of this vertical direction, earlier it was pointing occlusally. Okay, in Begg appliance it was pointing gingivally. This vertical orientation or opening was gingival. Okay, next modification there was addition of auxiliary springs. Okay, so how this wire was inserted, agar hum aise hi we insert the wire will fall out of the bracket because of this vertical. So he used springs and pins to retain the wire. So how did these springs help? Okay, so as we have already told you, if we just place a wire, the teeth will tip. There will be and won't be any rotation control or the root position control. So what Begg philosophy was, he first used to tip the crown, and then with the help of spring he used to upright the root. Tip crown, upright, tip crown, tip the crown, upright the root, tip the crown. That's how he used to move the teeth. Okay, so by using lighter forces, there was lesser demand of anchorage preparation. Okay, and lesser time was taken according to him for the treatment. Okay, so what were the advantages of his philosophy or Begg's philosophy? There was decrease in the friction. Okay, why there was decreased friction? Because circular wire. Remember how wheel was invented. Circular wire, less surface point of contact, less friction was there between the bracket and the arch wire. Okay, so less friction, less binding is there between the arch wire and the bracket slot, less forces are required to move the teeth, less need for anchorage preparation was there to overcome that undesirable forces. Okay, so I hope what was the philosophy behind Beck's technique is there. So there are three main stages in the Beck's mechanics. Okay, there is stage 1, 2 and 3. So what are the objectives of stage 1? First is bite opening. Next, correction of crowding or spacing, correction of any rotation, correction of any posterior crossbite, and correction of mesiodistal relationship of the buccal segment. Okay, next stage, objective. Maintenance of the objectives are achieved in stage. Again, sorry for the technical loss. There is some issue at my end due to which there is regular interruption. It won't happen again. So I've switched on the backup. So I hope there won't be any interruption now. Okay, so as I was telling, objective of stage 2 in Beck's treatment. So maintaining the objective is achieved in stage 1 and closure of extraction space if there is it's a extraction case. And stage 3 is maintaining the correct stage objectives achieved in 1 and 2 and correcting the root position. As I was telling, in Beck's technique there is tipping and uprighting. So torquing and uprighting of teeth is done in stage 3. Similarly, as I was telling, Beck was the another student of Tweed was the second student of Angle. So he remained in United States and practiced the edgewise mechanics only. So he gave his 4 stages of treatment: denture preparation, correction, completion and recovery. So preparation involves anchorage preparation. As I've already told you, edgewise anchorage is required, heavy forces. Correction, major tooth movement. Completion is finishing, and lastly settling. Okay, so in the recent years these appliances were labial. So in December 1980 there was a OMCO, which stands for Orthodontic Research and Manufacturing Corporation, decided to put together a team of orthodontists to develop and make suggestions for the improvement of this edgewise appliance so that it can be placed on the lingual side. So at this time the need for aesthetics was emerging. So these were the following members of the task force. So this was the lingual orthodontic appliance which came up. Two main scientists which are important are the Calvin Kurz and Kinya Fujita. Okay, so the name of these task force members are important. In certain senior residency exams of AIIMS, they have asked them which of the following were not the member of the task force of the link. So as I was telling, there was a number of appliances developed by various authors, various orthodontics. One of them was developed by Peter Kessling, known as a tip edge bracket. Okay, so as I was telling, was how the slots were angulately cut so as to incorporate the second order bend. Just remember this name, Peter Kessling and the tip edge bracket. Similarly, Levin Merrifield, he was a student of Charles Tweed. They together introduced the Tweed-Merrifield edgewise philosophy. Okay. Similarly, there was a technique given by Vic Alexander known as the bioprogressive technique. We are not going to discuss them in detail, just remember the names of these scientists. Okay, so Albert Ketchum was the founder president of the American Board of Orthodontics. So what was the difference between Beck's versus the conventional edgewise appliance? Okay, so as I told you, Beck appliance utilize round wires and light elastics, whereas heavy forces and rectangular wires in edgewise. So round wires means less friction, rectangular means more friction. Okay, so Beck's appliance utilizes stationary anchorage, means tipping, uprighting, tipping, uprighting. Conventional or the edgewise appliances utilize reciprocal, means forces, bilateral forces to bring together a teeth. So it was somewhat closer towards reciprocal anchorage. Next, few images of the orthodontic appliance materials. First image is that of a closed coil spring used to bring about closure of the space. So similar elastic method is the E chain or the elastic chain. This is the image of E chain. Next is the elastomeric ligatures or modules for tying the arch wire to the bracket. Similar version is using a Kobayashi hooks to tie it using a metal steel wire. So this is the image. A is one with which the wire is tied through modules. Second is the one through stainless steel ligature. These are the image of the Boone's gauge for properly positioning the bracket at the proper height on the tooth. This is the MBT gauge for proper positioning. Next is the Dontrix gauge used to measure the force, okay, applied to the teeth, okay, in cases of elastics, coil springs and arch wire. For measuring heavier forces in cases of headgear, space mask, we use Corex gauge. So this is the image of a Bonville-Hawley chart to make arch forms in edgewise technique. So this is the summary of the differentiating components of the various appliances, the passive and the active components. Okay, summary table, because in one of the MO exam they asked you which of the following is a passive or active component. This is the differentiating table for these various components. So we are going to discuss in brief about the important orthodontic component of the fixed appliance, that is the brackets, and the various materials from which they are made. So traditionally they were made up of stainless steel. Okay, what were the common methods to use to produce these brackets was, first it was the metal injection molding or the MIM technique. If you would have studied in prosthodontics, the injection molding technique, in which the liquid molten acrylic is pushed down inside the plaster mold to make the desired denture. Similarly, liquid molten stainless steel is pushed down inside the slot so that a mold made up of the shape of the bracket to make this stainless steel brackets. Next is through casting, similar way of casting caps and crowns in prosthodontics. And lastly, 3D printing. This is the latest technique. So the 3D printing is most commonly used for making lingual brackets. And what are the names? These are very important because it came in your exam. Incognito system of the lingual brackets by 3M company, and Omco company have manufactured them and sell them by the name of Alias or STP. Next came the titanium brackets. So why titanium developed? As we all know, there was a certain 10% of population who were allergic to nickel. Okay. Next advantage was better bond reliability with titanium as compared to stainless steel, because they were able to resolve more impact energy, reducing load on the bond during function. Disadvantage: titanium is rougher than stainless steel. We all know from our dental materials. They have a chemically active surface, deposition of titanium oxide, making it inert and more prone to friction. Oxide layer more prone to friction, more difficulty in moving the arch wire, more difficulty in moving the teeth. Okay. And lastly, we all know which are the very popular, the ceramic brackets. They can be made of single or many crystal. Okay, multiple crystal, more prone to fracture and breakage and are more rough. Single crystal, smooth as steel and allow for good slide. Okay, and lastly, today we are in the generation of individually customized brackets. As I was telling, various authors, various manufacturers incorporate their own tip and torque values, but these tip and torque values cannot be generalized for each individual. Each individual is unique in their body make and shape. So we have an individually customized brackets. They came in with the name of insignia system given by Omco. Remember, incognito are lingual, insignia are customized brackets. So don't get confused between these two names. So this is the manufacturing process of the insignia system. A 3D scan is taken. Damon. I'll come to Damon. What are Damon? Damon are self-ligating, passive self-ligating brackets. Okay, I come to that. So as I was telling, this insignia system as an individually customized bracket. So what is done is a CBCT of the patient is taken pre-treatment and a 3D scan is taken. So based on this 3D scan, it is incorporated into the computer software given by the insignia system, and based on this they give you individually customized tip and torque brackets. So this is placed using indirect bonding. Special trays of indirect bonding come, you just have to place them, cure them, etch, place the tray, cure, done. So as I was telling, incognito is a 3M lingual brackets, STB and alias are the oncolingual brackets, and lastly insignia are the customized brackets. So this is a summary of all three varieties. So according to Prophet, he said that certain types of brackets to be used at certain ages and certain type of treatment to be prescribed at certain, which is thrown away, not used, not taken care of in the Indian market. Whatever the patient demands, the doctor gives. Okay, so for 9 to 11 years in the States or United States, what they follow is they give shaped brackets, such as which are manufactured by the Wild Smile braces, with or without colored elastomeric ties or mini twin brackets, because at this age giving inconspicuous or hidden aesthetic brackets are not high priority for this age group according to their protocol. Okay, so their Wild Smile braces is a manufacturer who manufacture the bracket with a certain varieties of faces made on the brackets. Okay, 12 to 14 years they advise to give mini twin brackets with colored ties and shaped. 15 to 17 years high school students, aesthetics and clear aligners takes a priority, so aesthetic brackets can be, or aligners if permanent teeth are erupted. And adults highly aesthetic prone, so brackets or aligners or lingual appliances are preferred. So this is a classification according to Prophet. Okay, important for your exam point of view. So coming to the self-ligating brackets. Okay, so as I was telling you, the use of modules and ligature wire to place the bracket, then we have to tie the bracket around the arch wire. Okay, we have to tie the arch wire with the bracket. So imagine a situation, you are sitting in a room and there is a door, and imagine yourself as the arch wire. So if I close that door, you are the arch wire which can freely move around this bracket slot or compartment. So similar thing was developed with the bracket. So instead of tying them, what the orthodontists or the researchers or scientists did was they placed a door or shutter on the opening of the bracket. So the shutter is closed, the wire gets locked inside the slot. Okay, now this shutter can be like your room door, which is passive, so you can freely move around this slot or freely move around this room. Or this door can be active in nature, that means it exerts force on you so as to compress you to one corner of the room. So that becomes an active self-ligating bracket, and the one which does not exert force becomes the passive self-ligating bracket. So what was the advantage? First advantage was lesser chair side time. Lesser chair side time, more patient comfort, patient is happy. You don't need to tie individual slots with the arch wire. You just need to close the shutter, open it at an appointment, take out the wire, insert the new wire, close the shutter, done. Next advantage, in passive self-ligating, less force is exerted, the wire is free to move inside the slot. So what will happen? Less force, as I told you, less friction, less anchorage requirement is there. Okay, so these were the two advantages of self-ligating brackets. The first self-ligating or SLB brackets were developed by Russell, so they were known as Russell brackets. As I've told you, there are two types, active and passive. So active के example क्या है? First concept, as I've already told you, they have a flexible component or a spring clip which exerts active force on the arch wire. Okay, examples are very, very important. Examples are speed appliance and innovation. Please do remember these examples, they are very important. or these are the images of these brackets. So if you can see, the clip is exerting active force. See, it has compressed on the slot and exerting active force on the slot. Next are the passive self-ligating brackets, which are the most commonly used or mostly used. These are the Damon system given by Omco and smart clip system given by the 3M Unitech company. Okay, out of which Damon is slightly more popular among orthodontists these days due to their passive self-ligature nature. So these are the images of Damon brackets and the smart clip series. Okay, so this concludes my lecture on the evolution and components of fixed appliances. If anyone has any doubt, can ask me. Damons are the passive self-ligating brackets. Okay, so do keep studying. So this is a relatively quiescent or period in which the exams, INI exam is somewhat in October, November. Okay, NEET December, January next year only. So this is a peaceful time for you to study without tension. Okay, so do keep studying. Anyone has any doubt, please, you know where to reach us. Kindly again I'm saying, focus on those subjects for students who have already appeared and are reappearing. Those subjects which are not clear, do not leave them for the last minute. Okay, that you'll see, because then you'll be back to square one. जो पिछले एग्जाम में नहीं आता था अगले एग्जाम में नहीं आएगा. Near to the dates you tend to be in a bit of hurry, the stress is there. So focus on those subjects which are not clear, which you have which you have not covered in the previous exam. Okay, I already many times tell my students how I used to prepare is, I used to, in supposedly any textbook, MCQ textbook, most common you use is pulse में अगर एक साइड के पेज पे देखें, there used to be 20 MCQs. Out of these 20 MCQs, 10 to 12 will be there by जिसमें आप just you look at the question and you know the answer. Okay, so just cut those questions with a pencil so that while revising your time is saved. You don't have to look at this 10 to 12 questions. You just need to look at this 8 to 10 questions which are remaining and which you haven't studied or which you concept is not clear. What happens is mind का tendency होती है, it always tend to look, the eyes tend to go on those questions which are already clear. So after one, and if you don't do that, after end of 1 hour you are back to square one. You haven't studied, you have just mucked up or changed the pages of those questions which are already clear to you, and those 8 questions which are not clear to you before revising were not clear to you at this time as well. So at each subsequent revisions, those questions, thus 8 should keep on reducing. 8 becomes 5, next revision 5 becomes 3, 2, 1, 0. That whole page is done and dusted. You don't need to look at that page ever again. So you need to study intelligently and focus and manage time. Okay, so I have taken image thoda sa lamba time and there were frequent interruptions in between as well. Sorry for that. So if anyone has any doubt, you can know where to reach us. You can tag those who have my number. You can very well reach me on the WhatsApp. Don't have my number, can connect me on the Facebook as well. My name is Rijal Agarwal. Okay, so thank you for your time. Thank you for attending the lecture. Okay, so I'll close the session.